This is In Step with Compliance, a podcast by the Modern Practice Solutions team for dental professionals.
Welcome to In Step with Compliance, sponsored by Modern Practice Solutions. My name is Olivia Wan. In today's episode, we're going to talk about ergonomics. Is your job a real pain? Ergonomics for dental professionals. As you listen to today's episode, how do you personally feel? Is your neck hurting, or your back, or your shoulder? Musculoskeletal disorders can result in people missing work, lost productivity for the practice, increased healthcare disability, and it drives up workers' compensation cost. It is also very challenging, especially now during the labor shortage, to fill vacant positions that are caused by musculoskeletal disorders. So how does OSHA feel about it? Well, actually, the states of California and Oregon have comprehensive ergonomic regulations that require that we implement programs designed to prevent musculoskeletal disorders. And for the other states, it would actually come under the General Duty Clause in Section 5A1 of the OSHA Act. Each employer shall furnish to each of his employees employment and a place of employment which is free from recognized hazards that are causing or likely to cause death or serious physical harm to the employees. And really, if you think about it, if we recognize the hazard, yes, we have a hazard of repetitive motion, then what are we doing to overcome those hazards? So as you know, our team is made up of a variety of compliance trainers who have backgrounds in dentistry. And so I thought it would be very valuable to interview our team members and get the perspective from them, especially from the capacity that they served in working in dental teams. So let's start out with Caitlin. Caitlin is actually a licensed registered dental hygienist. So Caitlin, what type of harm occurs commonly in hygienists as they work in their dental jobs?
Hygiene can be a particularly repetitive job, and for that reason, musculoskeletal disorders are quite common in this field. One study indicated that 91% of hygienists surveyed suffered from MSDs. These disorders include commonly carpal tunnel syndrome, tendinitis, neck and back pain, shoulder pain, as well as a variety of other disorders. Factors that contribute to the development of these disorders include, of course, repetitive motions. Maybe if you're scaling a similar area with a similar tool for a large portion of the day, awkward postures, static postures, being in the same position again for a large portion of the day, forceful exertions, like when you're trying to get a big piece of tartar off, and poorly designed equipment and instruments. In our practice at Modern Practice, we have worked with hygienists who ended up transitioning away from clinical practice due to those musculoskeletal disorders. On the other hand, we have also worked with hygienists that practiced well into their 70s. One of these hygienists indicated that her secret to success was walking daily.
Thank you, Caitlin, for your insight about the common disorders experienced by hygienists due to the nature of their work, and also that, tight grasp on the barrel of the instrument and doing the same task over and over again, especially if you think about if they have root planing and scaling back to back, patient after patient during the workday. But office personnel are not exempt from musculoskeletal disorders. In general, office workers suffer with back and neck pain, and this can result in disc degeneration from that excessive pressure suffered by their spine. And being in that slump position, typing all day can cause nerve restriction and risk of repetitive strain and injury. So I want to talk to Brenda. Brenda has served as a dental office manager and various administrative duties in dental offices in the past. So Brenda, what's your thoughts about this and what have you seen?
Thank you. Yes. And being in the office positions that I've been in, we do see this with our office team members. Poor office posture can persist After hours when participating in social media gaming, watching TV, just sitting on the couch. Unhealthy positions can also affect digestion in some people. Incorrect posture can also affect lung capacity and make it difficult to take full, deep breaths. So, what we're doing in the front office in our dental practices, long-term computer use can contribute to all of those things because, again, we're sitting in that stagnant position for a great amount of time. Also, long-term computer use can cause eye and vision-related problems, in addition to headaches in our front office team members. One survey indicated that 29.5% of dentists suffered from MSDs. Endodontists suffered the maximum MSDs pain. In one study, it was 88.2%.
That's staggering. So not only are office personnel at risk, of course, our dentists are as well. And I remember years ago watching some dentists huddle before and after a seminar and seeing them slumped over. And I was thinking with these older senior doctors, how being in years of that position, bending over toward the patient, especially before the era where it was common to wear loops, that no doubt just result in a change of their posture. So yes, office work can cause a lot of problems. And, think about all of us compliance people. We're at a computer. If we're not on site, we're at a computer all day long. So we have to be mindful of getting up and stretching and also setting up our computer workstations in a more ergonomically correct manner. So our faces are directly in front of the monitor and not twisted over to the side, just about eye level. There's great information that we can gather online with resources. But what about our dental assistants? So Terri Walker has served as a clinical dental assistant for many years in the past for different dental teams. Terri, what's your thoughts about dental assistants and the musculoskeletal disorders that they might be susceptible to?
Dental assistants are susceptible to musculoskeletal disorders, including shoulder disorders, your back problems, neck pain, hand and wrist disorders. These risks are related to prolonged static positions, repetitive motions, forceful exertions, and lack of breaks. So how do we incorporate this change into dentistry? One thing you can do is do not smoke. Smoking results in progressive decline in the musculoskeletal system. To maintain a healthy weight, obesity may have a negative effect on your soft tissue structures also. Stretching can be a great asset to help prevent the MSDs. Some experts recommend taking a 5-minute stretch every 30 minutes. Stand up, move around, stretch those muscles. And then this ergonomic stretches are easily incorporated into your daily routine. And encourage your teammates to do some stretching also. Be mindful of an ideal posture when working on your patient. Utilize the loops. Position your patient so that they are in a position that makes it easier for you to sit with a straight back and not bend over to that patient. The patient is in the chair a lot less time than you are bent over all day long. So let them be slightly uncomfortable for a few minutes. That's okay.
Good point, Terri. So I think that's the biggest key that you mentioned is taking the time to stretch. And so often our dental assistants, they go from working chairside to cleaning the operatory to the very next patient. And so back to back to back, this can result in the potential for injuries. I worked with a dentist some time ago that she had a treadmill set up in her office, and she would encourage all of the employees to rotate in between the schedule to walk at least 10 minutes. And that 10 minutes it seems like a short amount of time as it relates to, well, you're not really are you going to lose any weight walking 10 minutes? I don't know. But the point was for people to get their bodies back into neutral position and to move around, to have good circulation and to promote good ergonomics. And so whatever that is, some may want to do some yoga stretches. I've seen at conferences lately, Terri, where They have early morning yoga before the conference starts to encourage dental personnel to learn some of these yoga stretches, which would be invaluable. And I know that we did this at our retreat. Caitlin, one of our compliance trainers, she led us in some yoga. And it was a great way to start our day, to stretch out, move around, and get our mind set for the day as well. And let's not forget good scheduling, not just at the front desk being a good scheduler, but putting that puzzle together properly would reduce strain on the clinical personnel, especially when there's difficult cases. Putting really hard patients and difficult procedures back to back can be hard on the dentist as well as the assistants and the hygienist. And so we want to be knowledgeable that when you manage repetitive tasks, I mean, we can't make it go away in dentistry, but when we manage those tasks, we can actually prevent prolonged repetitive motion that can result in a musculoskeletal disorder over time, if that's possible, and allocate the time for the procedure to avoid strain. And once again, that involves good scheduling techniques. So whoever's making the appointments has to have a knowledge of dental procedures in order to properly appoint the schedule, because you need to build in the time for clinical staff to actually do the work. But then, of course, there's the time to turn the room over and a moment to catch your breath, so to speak. So you want that buffer period built in, particularly for emergencies and catch-up time. So your dental practice can really benefit by incorporating positive changes that promote good ergonomics and reduce the risk from developing musculoskeletal disorders. I've always enjoyed looking at different hygiene instruments, for example, where the barrel of the instrument is a little bit larger to open up the palm to reduce carpal tunnel syndrome, or the saddle stool for the operator. So there's reasonable changes that we can incorporate over a period of time. It doesn't happen overnight, to reduce the risk of injuries and keep our valued team members in their jobs and doing what they love. Thanks for tuning in, and we'll see you next week.